Welcome to Rekindle XM. I'm Masha, your host, and my co-pilots are Michelle and Brian. Today, we are bringing awareness to an important topic. Our healthcare system has been quaking for quite some time. You don't have to be an expert to notice issues with access, cost, quality, and patient safety. You probably have stories of your own that you could share with us. But today, we're diving a little deeper, something that is mainly unnoticed by the tons. We have a very special guest today to discuss physician burnout, which in my humble opinion is the silent epidemic within our healthcare system. Welcome, Diane. Dr. Diane Shannon received a master's in public health from Harvard University, and her medical degree is from Thomas Jefferson University. She practiced primary care in Boston. As a young physician, she experienced burnout. Thereafter, through writing and speaking, she dedicated her life to drawing attention to ways to address clinician burnout, system inefficiency, and patient safety problems. Diane is now a certified coach running a coaching company helping women physicians achieve sustainable, balanced ways to work in medicine. Diane, pleasure to have you. Welcome. Thanks for coming on board. We are so excited to hear your story and share your learnings and expertise. And wow, what a role model and a fantastic woman that you have become. Thank you for being on and sharing your expertise with us.
Thank you for having me. It's a pleasure.
Absolutely. Well, is there anything you want to highlight about your past experience before diving into your background about why did you become a doctor and what did you discover versus what your passions and ambitions were?
Right. Well, I'll start with the reason I became a physician really was my mother. She was a certified nurse midwife, and she had amazing relationships with her patients. And I was lucky enough to see that because at times I would work in her birth center. And sometimes I'd be filing papers and things like that, answering the phone, doing some cleaning. And then a couple times I was asked to videotape or photograph births, and I got to see my mom in action. And I thought, that's what I want. I want those kind of trusting, healing relationships that I saw that she had with her patients and their families.
Wow, that's that's inspiring. I think so. Masha and I both, we were originally on the path to become physicians. We both ended up taking different directions, but that story of watching your mom and seeing that patient relationship, I think that's why a lot of people want to get into medicine. So I can only imagine. I got to see my sister as she was born. I got to be part of that, and that's an amazing experience.
It is an amazing experience. And I wasn't necessarily interested in going into maternity care, but I knew I wanted that relationship with patients. And so that's really what drew me in.
All right, that is fascinating. I also shared the love of, like Michelle said, of becoming a surgeon. Actually, neurosurgery was my passion, and along the way, I met my husband, who said, "Do you really want to become a physician in your late 30s, early 40s, have a crazy debt on your shoulders, and never be home to see your children?" And it knocked a pause into me. It's like, whoa, I did not consider that lifestyle. That is not what I had in mind. And he sold me his dream, which was a great dream, and we partnered up on a different life together. So my end result ended up being in healthcare administration on the other side of the patient care per se. But what was it like going through the Harvard program and then your medical degree program?
Well, my medical degree, the medical school itself was, the first 2 years were academic, and that was kind of very similar to undergraduate. And then the last 2 years were clinical, and those were the beginning of stressful, but they weren't quite as much responsibility or stress as residency. And it was when my third year in medical school, that's when you start in the clinical rotations, and I got to those rotations, and I thought, this is not what I expected. I don't see the relationship being supported between the clinician and the patient. What I saw instead was a lot of ways that the system or the processes got in the way of that relationship. And I also was very concerned about patient safety. And I trained before there was much recognition of patient safety. And so it really, the kind of gestalt of it all was that if there was a mistake or an error, it was the individual clinician's fault. And since then, we have so much research and understanding that when something happens, there's a series of mistakes or errors or gaps that have occurred that allowed that to happen. And there are so many ways to prevent those things from happening. But that wasn't the case. That wasn't the understanding then. And so I found myself very much worried about my patients and thinking, how can I prevent something from happening? Thinking about, I need to protect them somehow from this system or these processes that are just broken. And I spent a lot of time and energy and worry about that. And that was true beginning in that third year of medical school and continuing into my training.
And Diane, you said it wasn't quite what you expected. Did you expect there to be more of an emphasis on building that relationship and really taking care of that patient on a one-to-one basis? Was that more of the expectation, and then you just found it wasn't true?
Yes, I guess that's a good way to put it. I was so pulled in by that relationship. That's really what I wanted. And I wanted an education that was going to help me to get to that point, to build that kind of a profession or career. And what I saw was not consistent with that. Too many times there was even a lack of respect for patients. There was not enough recognition of preserving that time and that space, and that was just as important as some of the other things we were learning in the clinical years. And so that really, it was very much disillusioning to see that. Now, that wasn't enough to make me say, okay, that's it. I'm leaving. I did not feel like I'd made a mistake in entering my medical education, but more, how is this going to work? How am I going to navigate this path and create something that will work for me in the future? And I think for me, the burnout came both from the workload and the stresses in training, but also from the fear that I felt, the anxiety I felt for my patients, and the amount of workarounds. It takes so much cognitive load to be thinking about the treatment of this patient in front of me, but then also anticipating what could go wrong and trying to preempt that. And I think for me, that load of thinking that way and worrying just took a huge toll. And then, when it was moving from medical school into training, so I did a 3-year internal medicine residency program. And that first year was pretty killer, honestly. This was before there were any restrictions on duty hours, and it was overwhelming and really took a physical and emotional and cognitive toll on me. So I think it was the combination of those two factors. So yes, I was disillusioned. That wasn't enough to make me leave, but the burnout really, really took its toll.
So you mentioned that there was no restriction on work hours during that time. What was the average hours worked by a uprising physician like yourself?
So the worst year was internship year. After that, it eased up a little bit. And I honestly remember adding up the hours. I don't remember exactly what they were and what the max was. There was one week that was really pretty incredible. But my guess is it was somewhere around 100 or 110 hours on average. Like that was the usual. And then there were some weeks that were more than that. So it wasn't unusual to do 24 hours or 30 hours. And as an intern, it wasn't just that you were there and maybe you'd get called from your call room. You never made it back to your call room. You were on your feet that entire 24 or 30 hours. And that's just, it's it's not reasonable to expect humans to be able to do that on an ongoing basis over the course of years and not have it affect you. And there just wasn't the recognition. It was kind of this belief, well, we did it, we survived it, so you can do it too. And not really recognizing the downsides of that sort of training schedule.
Yeah, that happens a lot, even outside of the medical industry, but it's almost disbelievable that many hours come in, because there's no way you can take care of patients in a correct way when you're that tired. Mm-hmm. So yeah, I can see where the burnout's coming from.
Absolutely.
It occurred to me as you were talking, you know, we see this portrayed on TV, and we see, you know, interns and residents and how they're trying to grab a few hours of sleep in any empty room when they can. And it sounds like that is often true, at least at that point.
Yes. I remember there was one night early in internship, and I was on night float with another. There were two of us on. And so night float was you'd be on from 10, I think, until 8. I can't remember. I think it was 10 p.m. to 8 a.m. And this was just weekdays. So weekends you'd be on, you know, whoever was on call would be on call the whole 24 hours. But during the week, we were actually very happy they started this thing called night float, so that if you were doing your kind of regular day rotation, you could sign out at 10 o'clock and someone else would be watching your patients overnight. And that was us. And we ended up sleeping on the conference room table. I never actually fell asleep because we didn't have enough time, but we would lie down on the conference room table because there literally was not enough time to walk to the call room and get back before you get paged again. So I do have memories of that. And I will say that what surprised me in all of that was that I started having some memory lapses, but they were all outside of the hospital. So I would forget zip codes that I'd known forever, or telephone numbers. Now, this was before we had cell phones. So you actually did remember people's phone numbers, and I forgot phone numbers. And but I could tell you the potassium level of every patient I had, and I'd have 30 patients at a time, but I could tell you their medication list, their allergy list, but I couldn't remember a zip code. And so it was almost like my brain compartmentalized and said, okay, this is the priority information because you want to take care of patients, but that other stuff you're just going to have to let go of. But I did see that in myself, and it was concerning. I also saw, you know, as I got more and more tired, I saw myself becoming less compassionate. And that really disturbed me because, again, I went into medicine because I have this altruistic streak and I really care about helping people and alleviating suffering. And when I began to see that, it was really disturbing. And I will say that one thing that I did that was really helpful is right before I started internship, that summer before, I read the book by Samuel Shem called The House of God. And it is a fictionalized account of his training, actually here in Boston. And it was helpful because the things he talked about were kind of this very dark humor and that kind of eating away at your compassion. And so I could remember, oh, this happens to other people. This is, you know, part of being exhausted and tired and burned out. And it doesn't mean that I have become a malicious or uncaring person. There's something happening right now to me. And not that that wasn't disturbing, but at least I had this validation from something I had read before I started my training.
Wow. So a lot of physical stress, a lot of mental, cognitive stress. So prolonged duress within your internship residency program. And what was your mindset? What was your self-talk? It sounds like you started recognizing those symptoms, but was it initially, oh, I'm in burnout? Or was there something you kept telling yourself to endure the prolonged stress?
I absolutely did not know it was burnout. I had no idea. I actually didn't know burnout existed until, gosh, it must have been 10 or 15 years after I left practice. What I said back then was, I looked around, and this was before there was any discussion of burnout or physician wellness or anything like that. But I looked around at my colleagues, my peers, and I said, well, they all look like they're doing fine. What's wrong with me? Why am I having so much trouble? And I didn't have an answer for that, except you must be weak, Diane. It must be something about you that you can't hack it. And so I carried that sense of, I should be able to do this. I should be able to work 110 hours and not have it affect me and be completely, fresh and have my thinking be just fine and not have these memory problems about zip codes. So I was consistently telling myself I should be able to do this. And it, like I said, I didn't know it was burnout. I didn't realize until years later when I came across the definition of professional burnout, and I thought, oh my gosh, there is a name for what I experienced.
So
that's really interesting.
Started out overstressed.
Go ahead, Brian.
And you went to disillusioned, and then you became slightly disengaged. Was there a point where you became apathetic before you decided to leave, or did you catch yourself before that time?
Oh, apathetic. I think I caught myself, and I wouldn't say that was anything, brilliant that I did. It was more, what happened was the worst of the burnout was during training, those hours and just the level of stress and the increasing responsibility and feeling each time, like when you progressed from medical student to intern and intern to second year resident and then second year to third year resident, each time you felt like, I don't know if I'm ready for this. And that's a bit of imposter syndrome, but it's also a bit of, there's a huge leap on each of those transitions in terms of your responsibility. And so that was very stressful. When I finally went into practice, and I practiced for somewhere under 4 years, it wasn't as bad. The physical symptoms weren't as bad. I had more sleep than I'd had before. My memories started to be normal. But when I looked ahead, I kept looking for a way to carve out a life in clinical medicine where I could have a full life and not burn out again. And when I was in training, I was not married. A relationship that I'd had, a long-term relationship, broke up at the beginning of my internship year. So I was single and I didn't have children. I didn't own a house. I had no other responsibilities. And I thought, how in the world am I going to have a life and have these things that I want in my life and not burn out again? And I didn't see a way. Now, I didn't ask for help. I didn't know about help. I didn't talk to people about it because I had that level of shame about, why would I talk about this? Why would I admit to people that I'm struggling? And so for me, it was looking ahead and seeing, I can't figure out how to navigate this without having this happen again. And so I think I need to leave. It wasn't really well thought out, but I would say it did take me several years to get to the point of saying, I really need to I just need to leave. I don't know what else to do, but this is not working.
And Diane, you walked through very detailed thought process and burnout symptoms. Did you have coping strategy to deal with stress at that time, or was there simply no time?
Well, during medical school, I would run with some of my classmates. I trained in Philadelphia, and it was a really wonderful place to run. That the traffic lights were timed so that if you kept up a certain pace, you could run all the way down to the river and back in one swoop. And so that exercise was huge. I also have always read for pleasure, and that was a really good release for me. In terms of anything else, not really. And what happened was when I got to that internship year, I saw myself just shedding parts of me, my identity. So I stopped exercising. I stopped reading for pleasure, which I literally had done my whole life every night since I learned to read. I broke up with that in that relationship with that long-term boyfriend. I had less contact with family and friends. I had moved to Boston where I knew no one. And so I was really, like I said, shedding parts of myself to just try to keep up with the workload. And so in terms of kind of who I was and where I was, I didn't know. I think I was almost like becoming a machine. And I thought a machine is the only way you can do this. You can't feel, you can't have physical needs, you can't have like emotional needs. You just have to push through and do this. So I'd say I had some coping mechanisms, but then I like let them go and didn't really pursue anything that would have been helpful to me.
So at
That's
that
really
time,
interesting.
Go ahead, Michelle.
We've heard from some other folks as well. In fact, we just talked to a lawyer who, that's another obviously high stress, high performance industry. And there's a lot of similarities because he also talked about how it's like the job and what you had to do to survive takes over, and you're no longer able to do those healthy lifestyle habits that get you through and that have gotten you through. That seems to be a very common story. And I'm curious, did you notice that in your other classmates, the other interns and residents at the time?
Not probably, that's a really good question. I know that a number of them were either in relationships or married. And so they had this kind of built-in support system. And they also had ties that were going to keep them with some sort of balance in their life, right? If you go home, if you're, if you've got a spouse waiting, they're going to want to eat dinner with you, right? You've got something that's pulling you out. And so you, I think, have to set some boundaries around work. And I didn't do that. So I think there were ways that my peers, had more well-rounded lives than I did. And part of that, I think was they did have this sense of confidence, or appeared to anyway, a sense of confidence that they knew what they were doing. Now, I've learned since that many physicians felt the way I did, but didn't show it, right? And so it could very well be that they were struggling just as much as I was, but maybe hid it, and I hid it too, but maybe they hid it in a different way, or they had different coping mechanisms that weren't showing up. I didn't see other people who were contemplating leaving, but then again, I didn't talk about it either until I really had made the decision and left.
I think when you're really in a high stress situation, your ability to notice anybody else in a high stress situation is just not there. So even if they were showing signs, I'm not sure anybody would be able to pick it up anyway because they're in the same situation.
Well, we're also really good at hiding burnout for the reason that you said, shame. I showed no symptoms of burnout at all, just like our attorney guest at the last show showed no symptoms at all until we literally crashed physically. Taylor happened to fall on his face and break multiple bones in his face and had to undergo reconstructive surgery. I could not get out of bed. My body, my mind, everything just failed all at once. It was the plane crash complete. So very interesting journeys. They're little different, but there's so much that is similar across our stories. Like you mentioned, anxiety, cognitive load, and memory. not remembering zip codes and the phone number. I had those symptoms. I came to work and I was trying to log in. I've been using the same login for years, and I just blanked. Like, what is my password? What is my login? I use it 100 times a day, and it was just completely gone. When you said that you were shedding parts of myself to keep up with the world, what was that initial kind of a recognition of the journey that, okay, I'm not a machine. I can't keep up with this lifestyle. I don't want this lifestyle. Was this the wrong career choice, or was this more a different expectation of what the dream was versus what reality is?
Good question. I don't think it was a wrong choice for me. I don't regret that I went through medical school training, became a physician. I don't regret it at all. I do wonder whether at that point when I was struggling, if I had accessed help of some kind, a mentor, a coach, someone outside the system that I could have talked to and maybe come up with some better coping strategies or come up with a better plan for what my career might look like, so that I had a sense there was hope, that there was hope that I could create something that would work for me. That's kind of what I wonder about. Not so much that it was a mistake. I did not feel that. Like I said, I did feel disillusioned that there were both so many places of error, so many places to be concerned about, and also that there didn't feel like there was enough of an emphasis on protecting the relationships that are so healing. But I did feel like I could make something of my career. But at that point, I was really pretty lost, I would say. I didn't know what that might look like. When I was thinking about leaving, I thought, well, I am highly trained to do one thing, and that's it. And I was thinking, am I going to work in this was back when there were record stores. Am I going to work in a record store? Like, literally, what am I going to do with myself? And it did take a couple years to really identify that I have lots of transferable skills, and that it is possible to kind of create a career that's going to work for me. And I will say, I don't feel like I have wasted anything that I learned. That what I do now, I couldn't do if I hadn't gone through the training and practice as a physician, and the other pieces of my life, the 20 years as a freelance writer, trying to understand our healthcare system. All of that comes into play in the work that I do today, helping women in medicine.
And Diane, you mentioned feeling lost. How did you find your light and the path forward into transferring those skills and into doing something, building your dream?
Well, honestly, a piece of it was a friend who was not in medicine at all. And she had been working in IT in the prison system. So a pretty high stress job. And she decided that she wanted to become a yoga teacher and a writer. And it was a 180-degree change in her career. And I talked with her a lot about what was her mindset? How did she make that transition? How did she sit with herself as her identity changed from this one position that was stressful, and also it was an appointed position, so there was some clout associated with it. How did she do that and go to something that was less flashy? And that I found incredibly helpful to speak with her. And I think I was also very lucky. In the last year I was practicing, I went back for the master's in public health, and I knew that I was very interested in understanding the larger system factors in our healthcare system, and was really fascinated by learning about ethics and business and some of the other kind of community-based health, and how what the drivers are of that. And so once I did that, I was really open to looking for anything. And I happened to see an ad in the back of a medical journal for a position as medical director at a communications company here in Boston, where I lived at the time. Now, I have never before or since seen ads like that in this particular medical journal. They're usually clinical advertising or jobs that are clinical. And it ended up being a great stepping stone job. I worked there. I had lots of on-the-job training. And so when I decided to become a freelance writer, I could do it. And so I had taken kind of skills that I had from undergraduate, and I'd applied them in healthcare in terms of writing, and was able to make that transition. And again, I could not have done what I did for those 20 years if I hadn't been a physician and didn't have that clinical training. So it felt like nothing is wasted. But it was really important that I continue to follow my passion and not kind of like Brian had used the word apathetic. I think if I had become apathetic and stayed in any of these, it really would have been a not so pretty picture. But the fact that I kept saying, oh, this isn't quite right. I don't think this is working for me. I'm going to look for something and continue to try to see where might I find that? How could I use what I know or the skills I have now and apply those in a different setting that might be healthier for me?
Yeah, I think that's really
good that you saw that, because
yeah,
in my instance, I got to the point of apathy, and I knew I had to get out of engineering before I started making mistakes in my calculations and stuff. So, and kind of in the same way that you are, I'm still trying to figure out how to make the skills I learned from engineering cross over into other areas. So I think that's a blessing you found your direction quickly.
Yeah. And I like the fact that you're pointing out that, you know, in one sense, your passion didn't change because your passion was still helping people. It was still, you know, patient safety, and you just decided to shift a little. So it wasn't like you were abandoning medicine at all. And I think that's good for people to hear. So, you know, I thought I wanted to go into medicine, and I actually worked with a bunch of pathologists who, they were an interesting group, but they all told me, if there is anything else that you want to do or could do in medicine, like maybe you should go that route. And there were a lot of changes happening at that time. That was also mid-90s. But, you know, I never thought about that. And I think that so many of us don't think about all of the different avenues. You think, you know, nurse, doctor, you don't realize, oh, well, there's actually 1,000 other ways that you can help patients and that you can help the medical field. So I think that's really encouraging that you saw that there were other opportunities and that you went out and started investigating, looking for the right fit within that medical field.
Well, thank you. But that makes it sound like I was so much more intentional than I was. It was more, honestly, when I left clinical practice, it felt a little bit like I'd escaped, you know, like something bad was going to happen and I had escaped with my life, was kind of how it felt. So it was a bit of a relief. And at the same time, it was also incredibly sad because I had spent so many years and all my 20s basically to get to that point, and it didn't work. It didn't work for me. And so it was this combination. So yes, I was able to make those transitions. And in hindsight, it sounds like, oh, that, you know, I knew what I was doing. But no, I actually didn't.
Yeah, that's a good point too, Diane, because I think, you know, the three of us, Masha, Michelle, myself, Brian, we've all gone through that a little bit as well. And you're right. It's not this super smooth transition where the path forward looks super easy and you know exactly what to do. It takes some time to figure that out. And when you're looking back, it always looks easier than it is in the moment when you're trying to figure that out.
Yeah, absolutely.
And Diane, when you realize that you're not the only one who is struggling in this culture of the medical world and concerns that you've had, how did you come to learn about the professional physician burnout in the healthcare industry? Did one day things just fall into place? Was it more of a discovery through conversation? Tell me a little bit more about when you made that transition about looking into the healthcare system, and majority of physicians are struggling with burnout. Are there any statistics or any information that you can share about what is there that most people don't have the knowledge of?
Right. So in terms of when I got involved in this, it was probably the end of 2011, so a good bit of time ago. And I was encouraged or slash pushed by a very wise friend to tell my story. She said, you should really share your story. It might help someone. And my initial response was, there is no way I'm going to do that. Like this is a weakness. Why would I share this? And over time, I came to see that she was probably right. And I did share my story, and immediately physicians began contacting me to say, I didn't know anybody else felt this way. Here's my burnout story. And I realized how big this was. And it was really hidden at that point. I mean, there was not a lot of writing out there. And so after that, I was asked to be on a task force. I did some speaking across the country. I was lucky enough to write a book with another physician where we spent 15 months interviewing folks about burnout. And what came up over and over and over again was that burnout is a reflection of stress in the workplace. It's really not about the individual being weak or overly susceptible or sensitive or anything like that. It really is stress in the workplace. And that can take on various forms in terms of stress due to a values conflict with the organizational leaders, or it could be unfairness with how people are treated, like people within, different specialties in medicine, either making more money or less money or having special privileges within the hospital or not. So that like unfairness and workload. And if you have a tremendous workload and don't have the resources or the support staff to do it, that is a recipe for burnout. So understanding that it's really the system, and that was my focus for a long time. And in that period of time, writing the book, and that came out in 2016, and then we revised it in 2020. Back at that point, I think the burnout numbers were more like 40%. And now they're somewhere around 55 to 60%. So they're incredibly high. And COVID was part of that. But this epidemic was occurring long before COVID. And it was recognized actually as an epidemic before COVID. So the numbers are really disturbing. Another piece of data that's also disturbing is the number of physicians who are leaving practice because of burnout and also retirement, right? We have baby boomers who are now of retirement age. But, it begins to be an access problem for patients. So there's a lot there. There's all sorts of data. The numbers continue to, in the past couple of years, to rise in terms of physician burnout. And I decided to focus on women in medicine in particular because their burnout numbers are higher, and specifically those kind of mid-career, early career women tend to have the highest burnout numbers. And that's an area of focus that I really care about. And I think there's so much that can be done for that group, for all. But especially there's some particular challenges that women in medicine face that really could be addressed better than they are.
Wow, those are alarming numbers. In some industry sectors, we've seen burnout rates as high as 80%. And part of why we're spreading awareness is unrecognized burnout kills. It does kill. And if we're lucky to recover from that, many of us become the messengers of, hey, not every single symptom that you have is just one and off. And you go see 12 different specialists for a different symptom. In my case, they were all connected at the core. Common denominator was prolonged stress-induced burnout. And part of our passion is to have our listeners have aha moment. Well, maybe my weight gain and GI problems and depression and anxiety and a laundry list of other things have to do with an ongoing stress I've been having, whether it's professional burnout with performance, or many things just layering onto itself, leading to a collapse. Are there any other statistics that you wanted to share with us about the medical field specifically?
Well, one of the statistics that I think is concerning in terms of women in medicine is that there's some studies that have shown that within 6 years of finishing training, 40% of women physicians have either cut back from part-time or cut back from full-time, so they're part-time, or have left entirely. So, and the same study, the male physicians had not cut back. So there's something happening in those early years that's incredibly stressful for women in particular. And another piece of that is that women physicians have an infertility rate that is twice that of the general population. And so part of that is starting families later, but that's not all of it. Some piece of it is stress and circadian rhythm being disturbed. But right when they are beginning their practice, they've finished training and they're just launching their careers, is also when many of them are starting to have families and struggling with infertility and infertility treatments. And so that's a whole other added stress for them. And the other piece that unfortunately I would add is that the suicide rates. So there's not tremendous great data on this, but it looks like physicians have a suicide rate that is about twice that of the general population. And so it's estimated that we lose about 400 physicians every year to suicide. And that's the size of one or two or more medical school classes that are just gone. And it is incredibly devastating to a community, to patients, to the organization when a physician dies by suicide. And so there is a connection between burnout and suicide ideation. And so it's really something that we need to be so aware of. And if there is someone who you're concerned about, to talk with them, to say, hey, can we get a cup of coffee? How are you doing? To really reach out. And there are suicide hotlines numbers that are available as well that folks should have access to.
And we'll definitely publish them in the description. So if anyone is struggling with some of those thoughts or knows somebody who is, know that there is help and it's okay to ask for help.
Yes.
Yeah, and it seems like that it's hard, especially in the medical profession. I think it's hard to ask for help because everyone is normally coming to you as the physician to help them. So, Masha and I have worked with physicians. I've actually worked with them my entire 25 years. And I've seen some that when I look at them, my thought is, you don't look healthy. But I don't know how, I'm not a physician. I don't know how to encourage them. It's really hard to look at them and say, I think you need help. And you can see it on their face. Mm-hmm. But yet it's so hard. It seems to be so hard for physicians to ask for help.
Absolutely.
And one thing that can inspire that, and burnout is still not a common diagnosis in healthcare, although I believe now that there are diagnosis codes. I have not seen any protocols to treating burnout. And a concern that comes to me is that if our physicians are burned out, if up to 60% of them are burned out, and we have patients who are presenting with similar burnout symptoms, our physicians are ill-equipped to diagnose those patients and give them the right help. So if we can spread that awareness of there is a thing, how do we treat it? If people themselves who are going through that are ill-equipped to make those connections.
Right. So it's a little tricky because burnout itself, professional burnout, is not a disease state per se. And so it can be a little bit more tricky to come up with like a list of criteria. Like if you have this, this, and this, then you've got burnout. What I will say is that with the clients I've worked with, there's this continuum. And I should back up to say there are assessments that will look at, there's the Mini-Z burnout assessment. There's others that have been done that really can give you a sense of if a population has, like, what the rates are, but they're not meant to diagnose individual people. So like the Maslach burnout inventory is one that's used very often. And that was really developed as a tool, a research tool, to look at the prevalence within a population rather than saying this person has burnout and here's the thresholds. That said, what I have found is that it almost, whether you call it burnout or whatever, you can tell when someone is not thriving and they have some of the symptoms, Masha, that you described. And whether you call that distress, burnout, stress, whatever, something needs to be done. And there's this continuum where someone might be aware that occasionally they feel, some of the components of burnout, all the way through. There's true cognitive and physical and emotional impairment. And often they need time. So they need a medical leave. They need 6 months off to literally physically recover. And so there is this spectrum, and it's incredibly important to get that help. What that looks like can differ for different people depending on the severity and where it's showing up.
And I can see how passionate you are about treating unrecognized burnout. And of course, the important part is recognizing that you are in burnout. And Dr. Diane's book in 2016 that was updated in 2020 is called Preventing Physician Burnout, Curing the Chaos and Returning Joy to the Practice of Medicine. So if you are a physician or you have one in your household, that would be a great Valentine's Day present or early spring present. Pick those books up and look out for resources to help. If this is if this sparks up curiosity, listen to your intuition. Do some research. Mm-hmm. If you want to plug into our other podcasts, we do talk about recognizing the burnout and what those symptoms are. We're also talking other podcasts about treating. My apologies. We talk about coping methods, helpful and unhelpful coping methods to burnout. And the important message here is you are not alone. Many people, including the four of us, went through burnout professionally and personally, whether it's work-related or whether it's the weight of the world on our shoulders that basically caved in and everything just came crumbling down. What other solutions are there, Dr. Diane, about equipping people with dealing with burnout?
Right. Well, I think one of the, like you mentioned it earlier, the most important part is the awareness. And then I think having the courage and the willingness to access help. And that might be contacting a mentor, talking with a friend, talking with your primary care physician, seeking out help in whatever place you can, a coach like me or a group. There are also online groups that are available, and some of them are, there's ways of there being anonymous for physicians. So I think that awareness and then the willingness to take that first step and admit that you need help and trying to walk through that shame that there are so many people who are experiencing or have experienced burnout, and there's life on the other side of it. And it is a completely different experience when you are no longer burned out. Two of the key phrases that I've started listening for when I'm talking with a prospective client about burnout, one of them is that she will say, "I am so irritable with my children, and this is not me, and I don't want to be." And the other one is, "I dread going to work." And they dread going to work because of the onslaught of this kind of the feeling overwhelmed by the workload and feeling like they're getting just buried under it. And but I've started listening for those two phrases because they seem to be very closely tied to someone who's experiencing burnout from work.
That and be nice to your pets. That's a sign too. Brian, you had a comment?
No, I think those are very good indicators.
Yeah. You actually answered a question I was going to kind of ask you, because I know as a coach, you ask a lot of questions. Mm-hmm. And I was kind of thinking that, like, what question should people ask themselves? What do you often find that you ask them when they first come in that kind of helps people know where they're at? Because as you said, it's a continuum. I did not have a complete crisis, but emotionally I broke down and then kind of realized the rest of life just wasn't fitting. It wasn't the right lifestyle, right area, medicine, wrong fit, similar to some degree to what you had as well. But what is one question when people come to meet with you, what is one question that you ask them that maybe our listeners should ask themselves?
This isn't a question I ask them because I kind of take some time and ask more subtle questions over time. But to get to the heart of the matter, it would be, is your life working for you? And being really honest, is it working? Do you have the energy that you want to be really present with your kids, to exercise, to engage in some sort of hobby, to have the energy to meet up with friends? Or do the other things that are important in your life? And if the answer is no, then do you want to do something about that? And I think like that really, when I said earlier that I was like shedding parts of myself, that often happens as people are trying their best to maintain the work that they're doing. And they just, when they come to me, they've often kind of gotten to that point where it's like just the mechanical core is left, and all of the things that they love that really bring them joy or make for a well-rounded life, they've kind of had to let go of. And so the question then becomes, well, how is it working for you? And if it's not, don't you want something better? And what I found is that sometimes it's possible for folks to, depending on the severity. So if it's very severe, definitely need medical leave. If not, sometimes they can tweak where they are, begin setting boundaries, begin addressing people pleasing and perfectionism and other mindset issues. And they're able to tweak where they are and create a life where they can have, where they can thrive. And then other times they try that and that is not enough. And then they may need to move either to a different role in that organization or a different organization entirely or a different career entirely. And so it really depends. But I think, having that awareness of, is my life working as it is? And that is what prompted me to make the changes that I made. Was I was like suddenly, for whatever reason, came to right in front of me, no, this is not working and I can't keep doing this. I remember when I was trying to make the decision about whether to leave clinical medicine, there was an older kind of faculty member at a medical school, and he said to me, you can't leave because society has invested in you and you have been trained and you have to stay. And I didn't know what to say to that, right? I just felt more guilty, honestly. But later I thought, no, you know what? The real tragedy is if I had stayed in a career, in a setting that wasn't working for me for 30 years. That would be the real tragedy. And so I guess my hope is that people would just take that time to have a little introspection to say, is it working? And if it's not, am I willing to take that first step to either get help, tweak where I am, or to think about moving in some way?
Thanks for twisting that.
Great
knife.
Questions.
Wow.
Because it was 20 years of that, and I'm like, oh, that just hurt.
Diane, it's one thing to adopt the identity of I am job versus being told your identity is your job. I mean, that is incredible that there's that cultural conditioning and expectation, and we got to fight the stigma. We got to change the culture. We got to adopt the purpose and passion. Why are we here? Is this of my doing or of someone else telling me, hey, you are job, get to it? Well, amazing conversation. Thank you so much. One thing I wanted to call out for our audience is there are tons of resources. You can work through this on your own, like Michelle and Brian have, or you can work with a medical professional like I have. I did have to take a medical leave, and it's taken me quite some time to find someone who understood what I was going through and actually have a treatment plan that worked for me. And I recovered much quicker. And you can also work with medical professionals or coaches like Diane and get there quicker. The end result is you have to prioritize burnout. Burnout will prioritize you, and you do not want to be on its agenda. So wellness takes time. Wellness takes priority. Schedule that time for wellness and self-care, because if you won't, there's only one result. Eventually, it will bring you down. So invest in yourself, whether it's time and money, or money, still have to make time. At the end of the day, you got to pick up what's important and maintain what's important for you. And with that, thank you so much, Diane, for joining us. The links are going to be in the description of how to reach Diane. She has a website, www.dianeshannon.com. And we will also put a link to her book if you're interested in learning more.
Great. Thank you so much for having me. It's been a pleasure.
Thank you so much, Diane. And thank you for giving, the last 30 years to helping so many people.
Wow, what a wealth of information sitting right in front of us. An inspiration, to say the least.
Thank you.